Hello, everybody, and welcome. I'm going to get started here with the screen share, and we'll get kicking off on a topic that is hugely fun and important to me. So, quick introduction. My name is Kelsey Bailey, and I am a performance dietitian who lives in the Denver metro area. But I spent 8 years with military special operations, and then I've spent the last about almost six now years with fire and police, and have done some work with CAL FIRE before. So if you've joined for a webinar before, thank you, and thank you for coming back. And hopefully, we'll build on some stuff that you've maybe seen before. And if it's the first time you're seeing it, then hopefully we're laying a really good foundation for a topic that's super near and dear to my heart, and one that I have collaborated with so many medical professionals on, have seen a ton of good and really scary medicine been done. And so that's what today is let's talk about it, and let's talk about all of the components that come into recovery and what it means to have a robust and well-supported body. And that means hormone health that follows along with that. So um, we'll just dive right in. So, the road ahead that we're looking at today is we're going to define first, what are we talking about? What hormones? There's a ton that exist within the body. So, let's define which ones we're going to talk about today. What's the interplay between recovery, and what role does hormone health play within that? What's the interplay between nutrition and hormone health? So think about that as somewhat of a bi-directional relationship. Training, sleep, stress, environment, and then at the very end here, we'll do kind of a deep dive on low testosterone, which is a common question that I get quite a bit. And I will say I feel like some of the tides are shifting, at least at what I perceive that to be in the social media landscape and in even regular media landscape, and in questions that I get from folks. Is there's the conversation around hormone health and testosterone, certainly, and all that, but also now we have this like interplay too of longevity. How do I keep doing the things I want to do? So we'll kind of touch on that too moving forward. As an underlying foundation for this presentation, what I'd like you to really think about is, in a lot of these spaces, whether we're doing lab work or looking at wearable data, or even just like all the little like tweaks and hacks and whatever it might be, it commonly portrays the body as this like machine that we're trying to control, like adjust this, see this. And what I would really encourage you to think about is the body also as a giant sensing organ, where it is responding to things in its environment and often doing its best to manage what's happening. And this is especially pertinent in the tactical space when there are so many inputs that come in to the system that the body has to manage. And that we'll review a lot of them today. But that might be training, that might be environmental exposures, that might be just general stress, that might be sleep deprivation. And the body, from especially from a hormone perspective, is responding and sensing the threat or the safety or whatever it might be, and then responding accordingly. As much as we want to like tweak, see a result, tweak, see a result, we have to give respect to the fact that that sensing organ still plays a big role. So, why do we care about hormones, and really, like, what are they? They are our messengers. So they bind to different receptor sites within the body, and they tell that tissue or cell or whatever it might be to do something. So, for instance, with insulin, that's one of our hormones that allows glucose to get into the cell. Or testosterone can bind to our tissues to trigger muscle tissue repair, or sex organ development, or whatever it might be. They are messengers, obviously, yes. I also really like to think about them as these check engine lights. And so, especially for monitoring via lab work, oftentimes we'll see shifts over time, especially for regularly checking lab work, that before we have a flashing red, maybe we have a yellow check engine light that's come on and we should be paying attention to it. It may not mean that we need to do anything like start a pharmaceutical or whatever it might be about a yellow light, but get curious on why is this yellow to begin with. So a lot of the stuff that we're going to frame in this first half here is really thinking about what check engine lights is the body giving me and how is that related to my hormone health. So, what hormones are we talking about for today? Again, there are multiple, obviously, that exist within the body that play a lot of different roles. And for today's purpose, that we're going to be talking about, and especially as it relates to lab work, we have our sex steroidal hormones that we're going to talk about today. So, testosterone, free testosterone, estradiol, progesterone. Um, I have some of those additional ones and that others to consider at the bottom there. Thyroid hormone, so TSH is actually from our pituitary, but that's our thyroid stimulating hormone. And then we have T3 and T4, which are produced from the thyroid itself. So T4 is produced from the thyroid and then activated to T3. If we're looking into thyroid health, there's even more robust panels than just that. So some of these I consider like the screener section, and then we can deep dive as needed. We're also going to discuss some of our adrenal hormones, things like epinephrine, norepinephrine, cortisol, things like DHEA, androstenedione. So things that can play a role within the stress response that the body has. And then there are others that we consider in this overall picture, things like growth hormone and insulin, prolactin, luteinizing hormone is LH, and follicle stimulating hormone is FSH. And both males and females have all of these. So I know that things like estradiol and progesterone and LH and FSH are really thought of as like those are female ones that we worry about, but males and females have them. And if we're really trying to do a good and comprehensive assessment of hormone health, then we need to understand that the role that those play in the male body as well. So on the male side of the house, I know this slide is quite busy with words, and really I want this to be a reference that you can look back to later on if you want to be kind of deep diving a little bit more. But the big purpose of this slide is I want you to understand the different anabolic hormones in each body. So for the male body, testosterone is our primary anabolic hormone that's responsible for the sex organ development, mood, bone, muscle, cardiovascular health. It can be bound really tightly to that SHBG, which is a protein called sex hormone binding globulin, which can reduce its bioavailability, or it can be free floating around and ready to bind to receptor sites, or it can be weakly bound to this protein called albumin, which still allows it to bind to receptor sites. And this is important to note because when we look at lab work, we want to know what we're looking at. Because if we're just looking at total testosterone, your free T, the one that's bioactive and able to bind to receptor sites, might be in the trash if SHBG, that protein, is high and binding up that additional testosterone that's floating around. That happens in times of underfueling or in really high stress. So it's really helpful to get a good and clear picture of what is going on and even being able to advocate for what labs you'd like to see for yourself if you're curious about your own hormone health. So again, free T and weakly bound T can bind to those receptor sites, but the testosterone that's bound to SHBG is quite tight and not able to be bound to those receptor sites. Estrogen is also present in that male body, like I mentioned before, and plays a role within libido and brain development and mood. And progesterone plays a role in mental health and cardiovascular health and bone as well for males. But again, testosterone is that primary anabolic hormone. We have total testosterone, which is all of the bound and unbound numbers, and then we can really deep dive into the parsed out what's free and floating, what's bound up. On the women's side of the house, estrogen is our primary anabolic hormone that's responsible for our sex organ development. It is what matures an egg, thickens the lining of the uterus, impacts bone, has a role within muscle and brain health and cognitive function and cardiovascular disease risk, which is why when we see fluctuations within estrogen as it occurs within late perimenopause and early menopause into postmenopause, where we see the decline of estrogen, We can see changes in cardiovascular disease risk, in cognitive function, and how well our bone is forming, and how well we see lean tissue maintenance. All is really highly impacted by estrogen, our primary anabolic hormone. Progesterone's a big and main role within the body is, if you think about the menstrual cycle, is to thicken that lining of the uterus. Progesterone is often thought about as the nesting hormone because that nice thick lining that it makes within the uterus creates a home for a fertilized egg, if needed, and then if not needed, if that egg wasn't fertilized, then that lining is then what sheds within the menstrual cycle. Progesterone has some interesting roles within the body where it can enhance or counter some of the effects of estrogen, and it has a gross calming effect on the body. Uh, as the word SHB get bound, and then we also have the progesterone side of the house that has the impact from fueling as well. So if we're in that time of stress, we may not have that big rise in progesterone that we would anticipate to see. Testosterone is also present in the female body. It's mainly produced from the ovaries and a bit from the adrenal glands as well. We see that fluctuate again a bit in perimenopause and menopause for a lot of women, but has a huge impact on libido. Some on sleep, some on muscle, but really has a huge impact on libido when it's too low. And then on the opposite side of that spectrum, we can see when it's too high, that's often really tied to polycystic ovarian syndrome or PCOS. And if it's too high, especially if it's being supplemented from the outside in, so it's being provided either via patch or cream or pellet or whatever it might be, when it's too high, we can see changes in acne. Hair growth usually can occur, especially around the jawline. And we'll see some irregular periods that can occur with that too. Um, but again, a very prominent hormone within the female body as well. All right, so what should these look like? Because again, if we're like, I want to know about my hormones, we need to know what are they supposed to look like. So if we're testing them and we're wanting to do lab work and all of that good stuff, let's understand what we're actually looking at and when is best to test all of these things. So, testosterone, like cortisol, as you can see in this picture here, is considered a diurnal hormone, which means it is highest in the morning and then tapers off as the day goes on. And then we see a rise again within the evening. Cortisol, similar. We want its highest point after waking, and then we want its lowest point prior to going to bed. This makes sense. Cortisol is a stress hormone, so we want that hormone to be lowest when we're trying to get restful sleep. Testosterone, as well as growth hormone, have their highest peak overnight when the body's trying to do a lot of tissue repair and that anabolic function, so that building up. So both males and females will see that diurnal pattern. Females will obviously differ on the scale that we're looking at of total number. But this is why it's really, really important, whether male or female, especially when we're looking at testosterone specifically, and that free T and SHBG and those other numbers I mentioned prior, that we test close to waking. So ideal is within 2 hours of waking to get that accurate draw. Because if we're testing way longer after waking in that 3 to 4 hours, you're catching it on the downward trend, and then it's hard to look at norms and what your norm is. Where this becomes really, really interesting and challenging, I would say, in the tactical world is if you're working shift schedule quite frequently, your sleep is screwed up. So it's hard to always know when that 2 hours post waking is. So I do suggest if you have a day or two off to allow at least if you can get it one night of sleep before we get these lab draws and try and timing that as best as we can based off of when your normal waking is. So if normal waking is the afternoon, if we're doing shift work or whatever it might be, then trying to schedule it in the afternoon. If normal shift work is allowing you to sleep throughout the night, and we can try and get that within 2 hours after waking, um, on like normal shift life, then we would try to do that. But some of that also might depend on when a lab is actually open and you can get in to get this lab draw done. With that, I'd say we want to look at appropriate trends, then understanding when you woke prior to this draw. So if it's 4 hours after you woke up, then it might not be at that highest end of the range, but we look for consistency within normal for you. And this is why it's really important to work with a practitioner that understands and has some cultural competence around the tactical space and what shift work can look like, and whether we're parsing out, do we actually have a disruption in how the brain talks to the testes to produce testosterone, or talks to the ovaries to produce testosterone, or do we have, are we just looking at shift work? So it's important to be able to parse that out. But that daily rhythm stays pretty steady. So females, you can test at any day in the cycle, just same thing, first thing in the morning or within 2 hours after waking is ideal. And you can see the shift for female throughout the lifespan. So we have a bigger rise prior to 40. And then as we get into the perimenopausal time frame, we see it not rise as much. And then as we get postmenopausal, as ovaries no longer are producing as much, we see that number be way lower. Still ideally peaking within the morning. All right, going into the normal menstrual cycle, and I say this because so often when we talk about hormone replacement therapy or providing exogenous hormones, hormones from the outside in, I want people to remember what a symphony the body plays with hormone regulation. So, a lot of things are like hormone balancing and stuff right now. The body is very good at playing said symphony, but there are things that shift it, and it's really important to understand lifestyle wise what impacts that, which we'll go into. But I think the menstrual cycle is such a perfect example of this symphony because you see the rise and fall of different hormones throughout. So in this follicular phase, that's considered the lower hormone phase, days 0 to 14. That's where the estrogen and progesterone are lower. The days, 0 to 5, 0 to 7, maybe those the bleeding days. And then we see a rise in estrogen, cueing this rise in luteinizing hormone for ovulation. And then in this second half of the menstrual cycle, we want to see that rise in progesterone. Again, that means that the lining is thickening. We have our calming hormone ready to produce a nice, safe home for an egg if it needs to be. And then, if a fertilized egg is not bound to the uterine lining, then we see the fall of that progesterone and fall of estrogen to restart that cycle. This is really important because if we're looking at good ovulatory cycles for females, which means our hormones are working the way they are supposed to be, we want to see this rise in progesterone, which doesn't always happen. And you can still have a bleed and not have this rise in progesterone. And why that matters is there is a ton of tie to training and fueling when we think about what kind of signals, what kind of check engine lights the menstrual cycle is trying to give a female. If we're on oral contraceptive pills, it will look like the dose of the hormone that you are providing. IUDs look a little bit different, not as much of this like steady state. Typically, we're still looking for this spike of LH to trigger ovulation within an IUD. Um, but it is possible that some of the progestins that are on most IUDs could impact what that looks like from a lab work perspective. So just important again to note what if there is any contraception on board, what that looks like from a lab perspective. But oral contraceptive pills look like this. And then when we get into peri and postmenopause, people report feeling a little bit crazy and they want to test their hormones so they can see where they're at. And the truth is, it can look all over the place based off of what day you're testing, and it can look completely normal And you see, I don't, that's tiny writing here, but up to 5 to 10 years prior to menopause, which is one date on the calendar, where it's 12 months of no period for a full 12 months, is that menopause. So one date, before is peri, beyond is post. And we can see labs that are tied to these different stages. So the biggest number that we look at for perimenopause, we can look at estrogen, we can look at progesterone, but again, it might look completely normal. And that doesn't mean that you still might not be a candidate for menopause hormone therapy. Um, because the big triggers for that are the vasomotor symptoms like hot flashes, night sweats are the big indicators that you could likely benefit from a conversation with your prescribing physician around menopause hormone therapy. But the big lab that we look at that you can see really spikes up here is this FSH, and that's the follicle stimulating hormone that tells the ovary to produce an egg. And that gets louder and louder and louder as we lose eggs because the body's trying really hard to get the ovary to produce an egg. So as we have less eggs to give, that signal gets louder and louder. That's one of the big, especially if you see there's now like some at home, am I in menopause, like pee on a stick situation, and they're testing FSH within those little at home kits. All right, so what disrupts hormone function? So if we're thinking about this really lovely symphony that the body likes to operate within, the ability to perform and recover is that balance, is that symphony that comes in. And this is a giant laundry list of a lot of things that can impact hormone health. And I would not even say that this is an exhaustive list. So there's likely many a thing that I'm missing on here as well. But here's a lot of the things that I see within the work that I do. Um, Underfueling, especially when training volumes are high. And I'll say undernourishing as well. So maybe calorie. All right. Sorry, I think it might have paused for a second there. So skipping meals after training can increase those catabolic hormones. Eating too few carbohydrates for really high training volumes can um, impact hormone health as well. So increase that catabolic hormone, alcohol, and high environmental exposures. We are going to go into a lot of these in more in detail. So just wanted to give you a big list, but for definition purposes, for what we're going to hear moving forward, catabolic hormones are those fight or flight, epinephrine, norepinephrine, cortisol, dial up, perform what needs to be done. They are breakdown hormones. So they break down fuel and mobilize it so we can say, what do we need to do? And it will also elevate heart rate and elevate breathing rate to say what threat needs to be addressed. Anabolic hormones like growth hormone or testosterone, estrogen are those big build up hormones needed for repair, recovery, and growth. So when we're thinking about this, I want you to keep in mind, if seen me talk before, you've probably seen this slide, but I always like to really focus in on what does it look like to control the controllables that we have in an environment that can be wildly difficult to control. So it's hard to control work, it's hard to control stress, it's hard to control family. And if we think about this flame down here as inflammation within the body, are we dumping gasoline on it and causing the body to be more inflamed, making hormone disruption worse? Or are we thinking about doing those big rocks a service of watering down that fire, keeping inflammation in check, and being able to really support robust hormone health? All right, so what does all this have to do with recovery? So some of the big things that we think about with nutrition and as it relates to hormone health and recovery is we have to think about how are we refueling or how are we fueling our training just generally? Are we hydrated enough to do the work that we're doing? What are we thinking about for tissue regeneration? Or are we injured and we need to have specific components brought on board to help with injury recovery? And what am I doing to help support my sleep? As sleep is a huge component of recovery. So we're going to dive into these in a little bit more detail. And starting off from the very top, we have to talk about energy availability. And again, if you've heard me talk before, you have heard this, but I think it's helpful to hear again because it is when you think about rocks, big, big, big rocks that play a humongous role within hormone health. Does the body have enough fuel to make the hormones in the first place? So the body is very, very good again at sensing things. So good energy availability means we have enough energy to support all the asks of the body. So think brain, organs, muscle, bone, hormone health, immune system function, stress, training, and all the other movement you do during the day. That's good energy availability. All buckets are full with all of the amount of calories that they need. Think about your body like a house. House is super robust, not going to get blown over by a giant gust of wind. Body is safe enough to produce hormones. It's the thyroid feels robust and happy and firing on all cylinders, keeping our metabolic rate high, telling our sex organs to say, hey, you can produce this stuff. This is great because I'm safe enough to do all of this. Safe enough to repair, safe enough to prioritize bone, all the things that are really driven by a lot of different hormone fluctuations within the body. But if calorie intake is not matching that of expenditure, or again, calorie intake is too high, but nourishment is low, our house looks like this bottom house, like a shack. Like we're prioritizing stress and training and moving around because you're forcing the body to do it and you're gonna stay alive. But now muscle and bone and hormone health and immune system function are all down regulated. They are now nice to haves, not need to haves, in order to keep our house standing. So this is called low energy availability, and it is a heightened catabolic or stressed state that the body is in when it is underfueled or undernourished. And that is an inflammatory state. Makes it very hard to optimize testosterone or estrogen function. So we see that manifest in actual lab work, but we see it manifest in lower libido, in energy levels crashing. We see it changes within the menstrual cycle. And we can see a ton of changes within bone, especially in females. Changes in bone happen quite early, making risk of stress fracture and things like that grossly increase. We can see changes in muscle tissue recovery. So when we talk about recovery and hormone health, if we're delaying recovery or we're really prolonging it, we're sore for a lot longer because we're underfueled. We're unable to recover effectively, and we're down regulating immune system function. So ability to recover and come back and perform again in the job or in training or whatever it is hindered in that lower energy availability state. But I can't overstate enough how much we see this in lab work and how much we see it shift different hormones that we look at. So there's a lot of hormones that I look at with energy availability. Sex hormones are one, thyroid is another, insulin is another, leptin is another, that all are different hormones that interplay in a lower energy availability state that tell the body, hey, I am not safe. I'm going to slow everything down, slow sex hormone production, slow muscle tissue recovery, slow bone formation, slow hormone production, slow immune system function in an effort to conserve and manage the threat at hand. So, what we need to tell the body with our fueling is like, hey, sciencey stuff on it, but all these things, that low energy availability I mentioned, I just wanted you to see how we see these shifts in hormones. So we see that suppression of the thyroid, which impacts our active thyroid hormone, which tells the metabolic rate to slow down. So we don't mobilize fat as well, because the body's really trying to conserve. We slow down insulin production, we slow down estradiol and progesterone and testosterone, which again can impact bone, can impact even how many calories you burn in the day. So the body in this conservation state starts to change how we even just burn calories at rest in an effort to conserve. This LCA is low carbohydrate availability, and I mentioned this a hair earlier, but low carbohydrate availability impacts thyroid function, cortisol, testosterone, growth hormone as well if we're eating too few carbohydrates for a training volume. Too many carbohydrates is also not great. So we want to get in that kind of Goldilocks zone of providing good quality carbohydrate, which is whole grains, which is legumes, which is fruit, which is vegetables, which is dairy, which is nuts and seeds, all contain carbohydrate. So we want to make sure that we're providing good quality sources for the body to operate on, because though that low carbohydrate availability can worsen low energy availability, which worsens recovery, worsens hormone health. So it's all very tied together, which is why we have to start here because it has such a cascading impact on the entire body. This is just a couple of visuals that help you see that low energy availability impacts basically every single organ function we see within the body. And this makes sense because all of our organs function off of fuel. And if we don't have enough fuel, the body makes sacrifices. So we can see that in GI function. We can see it in how well the body utilizes glucose, how well the body makes lipids. So we can see elevations within lipids, and we see a giant decrease in performance on this other circle over here. Interestingly, you'll see this relative energy deficiency in sport, but there are models now being fleshed out for relative energy deficiency in military, which is more in line with what we see with tactical folks, which is sleep deprivation and stress and environmental exposures are way higher than the typical athlete population. So we see these same effects compounded because of the sleep deprivation and higher stress and higher kind of trauma exposure that you get from work and higher environmental exposures as well. So let's go into a little bit of like which nutrients play a big role within hormone health as well. Because when we're looking at labs, if vitamin D is low, it is one of the first things that I correct when looking at testosterone numbers. Because vitamin D helps make up the backbone of our sex steroidal hormones. So if vitamin D is low, it can correlate with lower testosterone. So we want to make sure that we're correcting any sort of vitamin deficiency before bringing on any sort of hormone therapy to make sure if it's something that's easily corrected, that we're doing that first. And we'll go into more reasons for that why later, but it is crucial for the production of testosterone and estrogen, and it impacts fertility greatly. People aren't great at screening vitamin D, so it's one I highly encourage, especially for anyone living above the latitude of San Antonio, because it is very, very commonly low, and if not clinically low, in suboptimal ranges. So I like to see vitamin D between about 50 to 70 nanograms per milliliter. 50 to 70 is what we want to see for that vitamin D range. Easily supplemented as well if needed. Looking for a vitamin D3 and K2 combo can be really helpful for supporting good bone health as well. B vitamins play a big, big role within stress management, and they get cached a ton in those that have really frequent fight or flight reactions. So we want to make sure that we're bringing them back in from the food that we are eating. Things like B12 will be in a lot of our animal products. Some of our other B6 and folate will be in dark leafy greens and legumes and whole grains. And if you're thinking to yourself, wow, Kelsey, I don't eat any of those things, then it's something that we want to be paying attention to because they are our energy catalyzers. So they help with that response within the body. And when they get cached, it's hard to catalyze those reactions. So it can manifest as fatigue, impacts our menstrual cycle. And we really want to make sure that we're able to support the body for the response that it's wanting to have. So whether it be through food items, which is always my priority, or we're covering bases as well with either a B complex or a multivitamin that contains robust B vitamins, then that's something that we look toward. So a thorn has a great multi as well as momentous that has a good B complex built into their multivitamin. But again, food first and really prioritizing those healthful food items I mentioned. Zinc is also really tied to hormone health for both males and females. For females, it's really tied to ovulation. For men, it's really tied to sperm motility and testosterone production. So after vitamin D, it's that second most important micronutrient that we consider for overall hormone health. When we look at zinc, you want to be testing RBC zinc, which is red blood cell zinc, because zinc is mostly housed within our tissues, which is hard to assess just when we're looking at blood. Because we're not testing tissue, we're testing blood. Um, so looking at the red blood cell zinc gives us a more accurate measure. Zinc is really common in our animal products. So if you're a vegan or vegetarian athlete or a tactical athlete, then we want to make sure that you're getting enough zinc through your diet. Um, but it's also one where we don't need to overload and we don't want to overload zinc. So it's not one where it's like blanket statement, go out and get a supplement for it because excess zinc can impact copper, which impacts iron absorption in the body. So again, these hormones play a really beautiful symphony, just like our micronutrients play a beautiful symphony. And any sort of provision of one can impact that flow of the others. Fourth on the list is magnesium, which plays a big role in regulating our thyroid and insulin. Can have a big impact too on the calming effect of the body, depending on which form we're getting. It's the second most common nutrient deficiency after vitamin D in the developed world. High in again those same things that B vitamins are high in, dark leafy greens and legumes and some nuts and seeds and pumpkin seeds are really high in mag. But it is one that's often supplemented because especially if you have really high sweat losses, you'll lose mag within that sweat and can be really, really helpful on calming the nervous system prior to bed. And I have some examples of that moving forward. So let's go into training a little bit. So pivoting onto our next kind of section here. Resistance training can be very, very helpful for optimizing hormone health for both males and females. And really, when we think about resistance training, that often what's talked about is that axial loading. So things like squats can be very, very helpful in optimizing testosterone. Believe the last data I looked at was like around 17% of an increase when it's regularly built in. HIIT training, when structured appropriately, which means you're not doing balls to the wall HIIT training for 60 minutes every single day of the week, but you're structuring it appropriately, can also positively impact hormone health for males and females. Excessive exercise or inappropriate programming or lack of deloads can negatively affect hormone health. Because think about the nervous system. Think about after you've had a horrible shift, a crap night of sleep, and you had really traumatic calls. And then you go into the gym the next day and you're like, I just want to send it. And we're taking that nervous system and we're kind of punching it into the ground. And that doesn't mean do nothing. Certainly not. But it means be mindful of how frequently that's happening. And if we can be a little nicer to our nervous system and say, I see that you underwent a lot. And now I'm going to try and support you with what training I'm going to do today. Because remember, the body's a sensing organ, it's doing its best. Too low or too high a body fat can also impact hormone production. So we want to make sure we're being really, really mindful of not going too low on goals because fat is essential for the backbone of our hormone production. So vitamin D plays a role, but so does cholesterol. And if we do not have enough essential fat on board, it can impact how our hormones get produced. And then too high of a body fat can also impact hormone production. And there's a fair amount of mechanisms for that, but one of them is the inflammation that comes along with excessive body fat, especially that visceral fat that sits in between our organs, gives off different components that can increase the inflammatory state of the body and impact hormone health through that pathway. So when this is in FIRE specifically that looked at a study between BMI and testosterone, and those in the lower testosterone quartile over here, a 59.4% that had low testosterone were in the obese category. 27.5 were in the overweight category. So that means we need to be paying attention to this as well. And if you know performance, then we know that BMI is not the end all be all, especially because musculature will change what BMI looks like, because BMI is only a factor of height and weight, not body fat. So keep that in mind when looking at this slide. But what this tells me when I'm looking at this is we should be paying attention to all of those lifestyle factors that are impacting obesity and overweight. And then that 3.1% here that are quote unquote normal BMI, what else is going on? What's going on in that communication between the brain to the testes? Is it sleep? Is it stress? Is there a true disruption that we need to investigate further? In borderline total testosterone, so that would be typically right around that 300 to 400 mark. Again, the majority is in that overweight or obese category for BMI, and about 15% are in that normal category. Again, something to do more further investigation on. And then when we have that reference total testosterone, we see it divided a little bit more. But what this also says to me is we have work to do when we think about addressing overweight and obesity in fire. But again, BMI does not take into consider musculature, so I don't want a blanket statement that more so let's consider body composition in this overall picture of do we have good and robust lean tissue to support good hormone health. So going into some of the other psychosocial characteristics that play a huge role within hormone health, I wanted to obviously sleep is something we talk about all of the time when it comes to lifestyle factors that we want to address within the tactical communities. And that's because the prevalence of sleep deprivation is upwards of almost 60% of fire. So then we really want to make sure that we're addressing it and talking about it because it has such a humongous impact on hormone health. So let's dive into sleep a little bit here. Sleep plays a role not only within the optimizing of testosterone and growth hormone overnight, like we mentioned before, but it plays a role within all long-term disease risk in the body as well, or a lot of long-term disease risk within the body. The big ones that we think of, like diabetes, obesity, cardiovascular disease, pain, behavioral health concerns, PTSD, all can be have a big tie to insufficient sleep. So when we think about biggest rocks, energy availability, sleep is such a humongous rock. And I call it one of those keystone habits because when it's dialed in and good, everything feels dialed in and good. But when it's disrupted, it impacts everything, kind of cascading down. All right, so when we think about hormone health, the body perceives this lack of sleep as a stressor and activates that stress response system, which blunts testosterone production. And we can also see it impact that communication. This section over here is the communication, a secondary communication between the brain and the production of testosterone and sperm health, and impact in serotonin production as well. So we want to be sure that we're addressing it because there's so many different interactions it has. And if we zoom out, it makes sense because the body's saying, why am I awake? And if I'm awake, it means there must be a threat that I need to be addressing. And so it acts in a stressed state, which increases inflammation and blunts hormone response. Interestingly, from the other side of the nutrition side of the house, it has an impact on glucose and insulin, meaning every time we have this stress response, we're mobilizing fuel. And sometimes we're not using that fuel. And if we have that over and over and over again, it's almost like the boy who cried wolf, where we're giving the fuel, but oh, just kidding, don't need it. Giving the fuel, oh, just kidding, don't need it. And when we have that excess circulating around, it is less effective of getting into the tissue where it needs to get for use in movement or energy production. We also see a change in ghrelin and leptin, and ghrelin is our hunger hormone, and leptin is our fullness hormone. So we'll see an increase in ghrelin, how hungry you are, and a decrease in leptin, on how full you are. And that mismatch can lead to overeating in a sleep deprived state. And it also leads to a lot of craving for refined carbohydrate. Again, zooming out, this makes sense. What is the threat? I must need to provide fuel to address said threat, and I'm going to crave what's going to give me fuel the quickest, which is refined carbohydrate. Things like cookies and donuts and crackers and pretzels and dessert, whatever it might be. Refined carbohydrate, sweet stuff, salty stuff to the face as quickly as I can get it in order to address said threat. So, what do we kind of do about it? If you've not ever tried this or haven't heard me talk yet before, this is one thing that I recommend for all humans in the tactical space to trial is this kind of recovery mocktail at night. You do this about an hour and a half to 2 hours prior to bedtime. And we combine tart cherry juice, which contains naturally occurring melatonin, and it's really high in antioxidants that regulate soreness. We pair it with some sort of protein. So we temper a blood glucose response. And then we're also providing building blocks for muscle tissue repair overnight. And bonus, if you can handle dairy, if you can tolerate dairy okay, you're getting all the electrolytes that naturally occur within dairy. Magnesium, we add on. And I mentioned mag before, and sometimes we supplement mag. Um, Magnesium glycinate can work on the nervous system to calm the system down prior to bedtime. Mag-threonate can cross the blood-brain barrier and has an impact more if we have insomnia or sleep disruption unrelated to higher volumes of stress. So, where I see that most frequently, just in my own practice, is like in perimenopause. Often we'll see changes in sleep architecture, and that mag-threonate can be really, really helpful on helping get into more restful sleep. I put a couple of third-party verified brands on there as well, so you have them. But again, hour and a half to 2 hours prior to bed and be consistent with it. Because in my career, I have worked with a ton of people who do not sleep or cannot sleep well. And this is the thing where people come back all the time and are like, holy smokes, this made such a difference. Can I give it to my children? Um, so be consistent with it. Give it 4 weeks, 4 weeks to see if it will work for you. We can't talk about sleep unless we're also going to be talking about caffeine consumption as well. Um, and I'm always a huge proponent of being aware of where your consumption lies. So if we're beyond 400 milligrams per day, we can impact that cortisol release within the body, telling the body, like, hey, get ready to go. Caffeine is a stimulant. That stimulant acts on our stress hormones, epinephrine, norepinephrine, cortisol. Let's go. What needs to be done? What threat needs to be addressed? Caffeine works on that same pathway. So, if we're providing excessive stimulant and go back to that sleep deprivation side of the house too, where we had a lot of mobilization of glucose, the same applies to excessive caffeine. So, we want to try and keep total intake below 400 or around 400 so that we can maximize our response to caffeine in an appropriate way because we want it for its ability to support performance and offset fatigue when we are staying up all night for shift work. But if we're so tolerant to caffeine that we can't reap the benefit, that's problematic. And if we're so excessively consuming it that it's starting to now impact cardio function at rest, that's also a problem. It makes you a liability online. So we want to make sure that we're being really mindful of total consumption and be wary of energy drinks because most have a supplement fact label. And if it has a supplement fact label, it is not regulated unless it has third-party certification on there. And last I checked, to my knowledge, Red Bull is the only one that has third-party certification on there, meaning somebody has gone in and said, is that amount of caffeine in that can actually what's in there? Like Bang says 300. Is it 300? Is it 250? Is it 400? I don't know. Because if it's not regulated and certified, then I have no clue. So being really mindful about, do I have a pre-workout and I have coffee and I have an energy drink, or I have a pharmaceutical that's impacting a stimulant release as well. And thinking about that overall load on the body, because again, sensing organ, what the inputs am I bringing in, whether it's environmental or food or nutrition. Alcohol was also on that psychosocial impacts that we see within fire, almost to that same amount of consumption as we saw sleep deprivation. So about impacting about 50+% of firefighters. Um, it can impact our sleep quality, that ability to get into deep sleep. So ties back again to that ability for testosterone and for growth hormone to optimize overnight, which can impact just how those sex hormones get produced generally. Um, Increases the cortisol levels within the body, so increases inflammation, and it is a known toxin. So the body has to handle it first before it handles other nutrition that comes in. I always get asked about what amount is safe when we're talking about alcohol. It is a known toxin. The more data that comes out, the more data that kind of supports this, like, is there even a safe amount to recommend? I am from Western Kansas and my family is all German. Um, and so it's always been a part of my culture growing up. And I recognize that too, that it can be a part of some culture and recognize its risk and recognize what else is being asked of the body. Like if I'm in a time of really high stress, I'm training, work is a ton, and I'm really just trying to do my best with nutrition and trying to get some sleep. Alcohol's a controllable within that. And if it doesn't feel like a controllable, then reaching out to resources who can help with that is highly important. I'm a huge believer in that multidisciplinary team. General rule of thumb when we think about cognitive function, risk of Alzheimer's and dementia. That data is around less than 7 drinks a week. When we think about the American Heart Association, they'll say less than 2 drinks a day for men, less than 1 drink a day for women. Again, as more data comes out, it's kind of like, is there a known safe amount is questionable. But going back again to, am I adding gas to that fire is really important to ask. So let's go into the stress because I mentioned this a few different times. And I think it's important to understand how we think about that and how we talk about that in the tactical space. Again, maybe this the first time you're hearing this, or maybe you've heard this before. But I think a reminder is always good that allostasis is the body has a stress response and comes back down. So homeostasis is the all those bodily processes, hormone function, all of those interactions like to keep a good baseline. Allostasis is that same concept within the stress response. So we have a response and we come back down. Have a response and we come back down. Stress responses are good and appropriate. We want them. We want them to come back down as well. Allostatic load is when we have to consider how many stressors are coming in. And this is not an exhaustive list on this picture, but gives you some of the ones that we think about. So are we eating enough? Are we excessively exercising? Do we have low diet quality? Do we have trauma that's going on? What's our social situation look like? What's our family situation look like? What's our financial situation look like? And how many of those things are we loading on? So, stress, are we able to come back down? Or do we just keep having a response and we see this rise over time? And that is what we call allostatic load. And when that load gets too high, we see the breakdown of resilience, that ability to have a stress response and come back down and address the next thing that comes up. And this is wildly important to recognize as it relates to recovery and relates to hormone health. Because when we've reached that allostatic load point where we've lost that resilience, it manifests all over the place. Manifests in hormone health, it manifests in delayed recovery, it manifests in sleep, it manifests in how well we're handling stress. So it's really, really important to recognize in that overall context of hormone health and recovery. When we see it specifically as it relates to testosterone, we see a kind of that blunting response. And I'll show you a chart here in this next slide. But think about cortisol as that it's a catabolic hormone, it's a breakdown hormone. So when we have estrogen or testosterone that's trying to come up against a highly catabolic hormone, it's difficult to get that optimal testosterone release or optimal estrogen release because we're fighting against an entire state of the body that's stressed, that's saying, not the time, not the time for anabolic function. I am addressing a threat. So we can see that manifest in mood and libido, again, I've mentioned earlier, changes in a menstrual cycle function and fertility can impact weight gain as well. So when we see excessive cortisol, we often see excessive gain around the midsection. And going back to that energy availability is it's very difficult to mobilize body fat when the body is in this wildly stressed state because it wants fuel fast. And body fat is enormous molecules, and it takes a lot of oxygen to mobilize those. So when we need fuel quickly, the body is saying, screw fat, that's not an effective fuel source. I got to go with something easier, which is typically carbs. But let's say we're not eating enough carbs, then we go to lean tissue. So we're breaking down muscle tissue in an effort to support this. So it makes it very difficult to effectively lose body fat in this state as well. So I mentioned this pathway, and I'm sorry because I know it's a little hard to look at. But we have these backbones of our hormone production. And then down here we have testosterone and we have estradiol. Precursors to that, DHEA, I mentioned way at the beginning of is one of the ones we consider. We actually test DHEAS within the bloodstream. That's how it circulates around. But its precursor is called pregnenolone. And in times of really high stress, this pregnenolone can be taken over here to produce cortisol. So that's important to note because then we don't have the precursors needed to produce testosterone and estradiol. So it's just another depiction that you can visually see of like, why does this happen? And it's because, again, the body's managing the state that it's in. So it's taking precursors to our sex hormone production to say, busy, no time for you, must produce cortisol at this time point. We can also look at a testosterone to cortisol ratio to understand how is the body handling stress? How is it handling training? And are we at risk for lean tissue breakdown at rest? So it gives us that kind of anabolic versus catabolic ratio that the body is in. It can fluctuate based on a wide variety of factors. Obviously, sleep deprivation, is stress going on within life generally? Do we have a new baby? Things like that can all impact what this ratio looks like. But it's important to look at trends to really understand this. But again, can give us an indication of when we have a lower ratio where cortisol is higher and testosterone is lower, it can influence that risk of muscle tissue breakdown at rest and can be one of the markers that we look at for overtraining or really poor recovery. So what do we do about it on the nutrition side of the house? I'm a huge fan of appropriate utilization of adaptogens, which is exactly like this definition states, is it's meant to increase the body's ability to resist the damaging effects of stress, aka improve resilience to the stress response. Have a response, come back down. Have a response, come back down. Um, Adaptogens, historically, herbs, amino acids, things like mushrooms, all can kind of fall into this category, have historically been kind of a sketchy area within the world of supplements. And there hasn't always been like a really robust, high quality amount of these things. And they can have a fair amount of impact with other hormone health or other pharmaceutical health within the body, so they could interact with other medications. So we want to be cognizant of that as well in the individual use of these. But I wanted to go over two that have third party certification now. So again, in the supplement world, they were pretty unregulated. Were you actually getting what you thought you were getting in some of these products is questionable. There are now two on the herb side of the house that are third party verified, third party certified, meaning what is on the label is actually what's inside the bottle. So ashwagandha is one, can be helpful for sleep, is my most common place of recommending it, but it's non-drowsy, so it theoretically could be taken at any time. But I really, if you have your tart cherry and Greek yogurt, hour and a half to 2 hours prior to bed, bringing on ashwagandha at teeth brushing time, and then in bed, if we're still stressed out, looking at things like meditation or progressive muscle relaxation can be really helpful for calming a busy brain prior to sleep. Am I reliving something that happened at work? Am I running through to-do lists? Ashwagandha is very helpful for saying, shut up and go to sleep. So dosing is about 500 to 600 that we'll see for ashwagandha. Momentous and Clean Athlete both have those third party certified versions. This is one that can interact with other medications, especially thyroid meds, so should be considered in that overall picture. Rhodiola is my other favorite herb to utilize. This one has a slight stimulating effect, so should be taken in the morning, but also has some interesting data around performance and aerobic performance. Um, I personally call it like the fuse lengthener. So as you know, things can trigger um, different stress responses during the day. Sometimes that fuse is long, sometimes that fuse is short. I call rhodiola the fuse lengthener. The dosing range is quite large, 100 to 600. So I typically start people with about 200 milligrams in the morning and see how they do. The interesting thing about rhodiola is if you have a horrible call that you go on and you would like to come back down before you need to go back online, rhodiola can be a tool in the toolbox to do an additional 100. Both of these I recommend cycling. So on for 8 weeks, off for four, on for 8 weeks, off for four, or utilize as needed. So if you don't need them consistently, take them as needed. If you're in a stressful period of life, on for 8 weeks, off for four. All right, so let's talk a little bit more about the job and some of the impacts that exposures can have there. Um, so I think it's probably no surprise to any firefighter out there. There's been so much conversation around gear and what you get exposed to within fire and some of the pollutants that come when we're especially dealing with wildfire. We have heavy metal exposure within that as well. And those things are called can be called endocrine disrupting chemicals. So they can impact the body's ability to produce estrogen or testosterone or progesterone, impact thyroid hormones. Some of them can impact insulin and glucose. Some of this is also like the plastics that we get exposed to. Some of it's flame retardant, some of it's within the gear itself, things like PFAS. But they can impact the body's ability to produce said hormones, and some of them act as hormone mimickers, where these compounds that we get exposed to can actually bind to the receptor sites that we'd actually like our real hormones binding to, and instead impact a hormone function in that way. So on the female side of the house and male side of the house, there's some really, really great resources about some of the environmental impacts that we see within that. And I don't say this to have like kind of scare tactics by any means, but when we're talking about hormone health, I think it's important to recognize and do what we can to best support everyone. So higher miscarriages rates than the general population in both police and fire. So the average rate for fire is about 22%. The general population is around 10 to 12%. Higher risk of preterm birth and fire, especially if work isn't restricted but before the third trimester. I think a lot of departments have heard this and have shifted women into light duty in that second trimester to help offset this risk. Um, and then looking at return to duty timelines and how those differ can also impact that postpartum hormone health for women. And it can impact our Müllerian hormone. So the AMH is a marker of how many eggs are left within that reserve, and we see a lower AMH within fire in women. We also, interestingly, for males versus females, there is lower rates of obesity than their male counterparts. Um, and there's some interesting data around this. It's like, are they better at dealing with the lifestyle impacts than the men are? I don't know if that's the case or not, but interesting to note just generally. But both still have high exposures. So whether again that's gear, it would have to take some particular consideration around breast milk as well, which can get some contamination from things at home or in at work. So what kind of personal hygiene products are we using? Are we showering after changing gear, before pumping, things like that? Um, and you guys know this again. I mentioned the gear already carries PFAS. I really try to be so crazy about, are we wiping off our hands and our mouth before we put food in after we've addressed a fire? Are we taking off gloves? Are we touching food? Are we touching a wrapper? So just little things like that that can make a big difference in some of these exposures. This can be kind of a swirly, twirly world of nutrition. So I always like to remind people that in this space, there are things that we can control and things that we cannot. So we should focus on the things that we can control. So some of that is just reducing the exposure where we can at home. So can we filter our water? Can we not heat things in plastic? Um, do we have air filtration? Some things like plants can even help with that at home, especially during wildfire season. Can we assess some of the household products that we're using? Does everything have like a ton of scents within it? So looking at our laundry detergent, makeup, and soap and things like that. Again, this can be a little bit swirly twirly. So choose one. In our house, we did a first of an overhaul of the things that I brought my lunch to work in. So instead of bringing in plastic containers, could I start bringing in glass? And that was like year one. And then year two was, can I take a look at my cookware and save up some money for that? And then year three, it was like, okay, now I'm ready to figure out like what shampoos and conditioners and body wash do I like that have lower environmental exposure. The environmental working group can be a good resource to kind of parse out items here. So you don't have to do a ton of guesswork on your end. You can just type in soap or laundry detergent or whatever it might be, and you can see some recommendations there. I also am a huge proponent of obviously supporting our own and natural detox pathways, things that make a healthy liver and healthy kidneys, because those are our big detox organs. Probably to no one's surprise, that's lots of color and lots of fiber. And we want to be sure too that like if you're someone who's already at risk of cardiovascular disease or fatty liver, that challenges some of these detox pathways. So we really want to take nutrition intervention seriously. So let's pivot here because we've talked about a lot of things that can impact hormone health, that can impact recovery from the lifestyle perspective. And I am not a prescribing physician. So I want to caveat this next section as I do not prescribe testosterone. I do not prescribe menopause hormone therapy. I am not a prescribing physician. I work with a lot of prescribing physicians. And I have seen a lot of things in my career of really good medicine and really scary medicine, and maybe even really inappropriate medicine. That did we do the appropriate steps before we provided something that now is likely a long-term, lifelong thing that I will have to stay on? So let's dive into this conversation with those caveats. If you have not already seen the IAFF put out this giant info doc on testosterone. It's from 2020, but still has some pretty good information within there. I think it's like 17 pages long, but it has some nice reading that honestly gives like, how do we actually assess this appropriately? Because again, I'm a huge proponent of us talking about it and us understanding it, but also being wary of predatory wellness, which is trying to sell you something. And I love to believe that there is not like nefariousness in those intentions, but sometimes the medicine that I have seen is nefarious. And I have recommended folks to pursue medical malpractice because of how inappropriately they were handled on the hormone health side. So this IAFF doc has a lot of really great information. So let's go into some of its prevalence. So if we're looking at low T specifically, the exact data varies, but what we'll see is about 10 to 20% on the lower testosterone side, which means that below a 264 is what the Endocrinology Society puts as that low end. Again, I'd argue that's pretty low. And again, we should track this because there's so many things that we went over before that impact this. There's a couple of different papers that show that combined of the borderline low and low. So think about that as anything below 400 altogether is about 1 in 3 that might be having lower testosterone or borderline low testosterone. Have we worked on sleep? Have we worked on nutrition? Have we worked on training? Have we worked on stress? Have we looked at body composition? Those are things we should always ask first. We should do investigation appropriately, and we should also ask those lifestyle questions. In the general population, the prevalence increases with age, but it's typically what you'll find in the data is around 2% prior to age 50, but it's highly related to other factors like obesity. You'll see way higher rates, in diabetes, higher rates, things like that. But again, a higher prevalence likely tied to basically all the things we've already talked about in this presentation. So again, why I'm such a huge proponent of it, testing it year after year after year, so we can track and trend for you. So what are some of the symptoms of low testosterone? I'm sure none of these are wildly surprising to people, but reduced libido. I always ask about morning erection. Do we have difficulty concentrating? Changes in body composition, increase in depression. And not all of these are directly tied to just testosterone alone. So again, why it's important to look at all of those lifestyle factors together, because if we can impact a few of those and we see a big jump in testosterone without providing it from the outside, that's fantastic. And we can then continue to monitor over time as life shifts. And again, if we're appropriately assessing this and you're a good candidate for low testosterone, then great, let's get you the appropriate support. But oftentimes, what I find is that people ignore steps one, two, three, four, five of assessing lifestyle and jump right to sex 6, 7, 8, 9, 10 and want to jump to exogenous provision of testosterone. And I want you to think about that as low testosterone is a signal. It is a check engine light to tell you that something else is going on within the body. And if we just provide it exogenously without looking at what else is going on in the body, it's essentially like putting a band-aid on a bullet hole because we don't know if we're actually correcting why it's disrupted in the first place. And sometimes providing it exogenously is the answer, but often we're not doing that full assessment. All right. So how, when, and what to test. I talked about this a little bit at the beginning, but ideally within 2 hours after waking, we want to be fasted, especially for some of these other labs I have listed down here. No strenuous workout or sex the day prior. Um, if a low lab is found, so below 300, then at least one retest is recommended within ideally as well rested as you can be state. I always encourage this to be compared with subjective symptoms because that will get asked. And a huge nuance when understanding testosterone is that someone might be at 450 and feel great and be performing well and recovering well, which likely means those receptors that are binding to testosterone are full. They are getting all the testosterone that they need. We are responding well, no problem. But someone at 450 might also feel like garbage, and the recovery is crap, and their libido is crap, and their sleep is crap, and we've already parsed out some of these other things. That might mean their receptors aren't fully matched up with testosterone. So, receptor density is a huge component to keep in mind because just looking at total testosterone or even just looking at free T does not always give you that full picture, which is why it's so important to compare with subjective symptoms. So, what is my sleep? Scale 1 to 10. 1 is crap, 10 is amazing. Sleep, stress. 1 is crap, 10 is amazing. Nutrition, exercise. If you can scale those 1 to 10 and some of those other symptoms and bring that in to have a conversation with a prescribing physician, that's so much power to be had to say, okay, where do I really need to drive my focus? And what trends am I seeing? So, what do we like to test? We want to test the thyroid because thyroid controls metabolic rate, but it also controls sex hormone production because it's telling the body, am I safe or am I not safe? Do I need to hit the brakes or can I fire on all cylinders? We want to look at total T, free T, and SHBG. I mentioned that at the beginning. Vitamin D because it's that hormone backbone. We want to understand cortisol. So, is stress playing a role? Looking at fasting insulin and A1C and lipid profile can also be really, really helpful. And then bonus adds on, if we can get estradiol and prolactin, that also can be really helpful of understanding what to test and what's going on. If it's low, it's likely worthwhile to add on a few more tests. So FSH and LH are the communication within the brain that happens then to the testes. We call that secondary hypogonadism. Where there's a disruption within that communication. And these labs help us assess those things. And then we can also look at some micronutrients and make sure we're not deficient in any of those. If there's like a large amount of like gut disruption as well, or obesity or sleep apnea or traumatic brain injury, that should also be taken into consideration with this overall picture. So now what? I mentioned this already, but lifestyle intervention should always be addressed first. And in fact, when I was working with the military, we had a 6-month window where we had people work on lifestyle intervention and followed up again to see if they were a candidate for exogenous testosterone. Because we dialed in these lifestyle factors, and if we were still low, then that's something we really need to medically investigate because low T can have an impact on cardiovascular health and mood and cognitive health. So it's important to understand that. So we need to understand, is it truly low testosterone or is it one of these other lifestyle factors? Um, and I highly, highly recommend if it is truly low, working with urology or endocrinology who are trained in these more symphony-like relationships of hormones, because there is so many different things to take into consideration of who qualifies and how we want to handle that, especially as it relates to fertility, because testosterone can lower fertility. So if you're wanting to have children, that's maybe not something that we want to go down that road of right now. And I always want you to hold caution of those companies who can profit from this as well. I mentioned this earlier. I'm not a prescribing physician, but there are things that I want you to hold on to and you to talk with your medical provider about, which is understanding our goals of screenings and what medical indications are for any sort of exogenous provision of it. So what that means is, are we tracking this yearly? Understanding fire is a population that has higher risk of lower testosterone. Um, are we taking into consideration that fertility or trying to conceive efforts? What does referral and access to care look like locally where you're at? What are the dosing goals? So I saw this all the time where people would say, oh, my goal is to be at 1,000. That's like, that's not individualized medicine. That's getting everybody to 1,000. So if we're wanting to do individualized medicine, typically the ranges that you'll see with most endocrinology or urology is right around the 600 mark for total testosterone. But again, not the only lab we should be looking at. Another huge thing that I look at is, what does the initial and follow-up lab work look like for the physicians that you're working with? And what does the continued follow-up of monitoring things moving forward look like? So are we continuing to monitor not only just testosterone, but how estrogen is getting affected by this, the thyroid side of the house, continuing to monitor micronutrients and stress along the way as well. Some questions that I encourage people to ask, again, because I can give all the recommendations in the world of like, go through urology and endocrinology, though, like try to get through good appropriate referral pathways. And I know people still want to seek out additional support in other avenues. So questions I always would encourage you to ask is, who is prescribing? So what are their credentials? What's their training? Was it a weekend course? Because in my local area, that's quite a frequent occurrence. Mode of delivery. So is it gel? Is it injection? Is it a patch? Is it a pellet? And how does that dosing look? And what's our strategy around that? And pellets have so much less data on being able to appropriately like kind of titrate and keep better control over lab markers. Again, what's that lab work schedule? Am I testing it every 4 weeks? Am I testing it after the first month and then after 4 weeks? Am I assessing regularly? I've had some people who came from clinics where they never did follow-up lab work, which is wildly inappropriate because overdosing testosterone can have a wild amount of different impacts within the body, the largest of which that we have a ton of concern around is a cardiovascular risk, so heart attack or stroke, because the blood gets quite thick. If who you're working with is recommending bloodletting, this also happened to me in the last year where a clinic was recommending every 4 weeks people give blood in order to better manage this increase in red blood cell production. And that is an inappropriate dose of testosterone. And I will say, of this particular section of the presentation, I've also consulted with those prescribing physicians I've worked with to create this list. And who's profiting? Who is making money off of this? So some companies are getting some kickbacks from the more times that they're able to prescribe or insert pellets and things like that. So we really want to always ask that question of who is profiting, um, and be wary of that. My goal for everyone that I work with is perform well now and retire well later. And sometimes that means that we're assessing this lab work really effectively and appropriately throughout an entire career to keep you really, really, really well supported. And where I get mad is when I've seen that predatory side say, like, oh, because of your job, because of the sleep deprivation and the stress, I know you need this, without actually assessing the lab work over time. And especially if they're misdosing humans, which increases your risk drastically for a cardiac event, can increase rage, can impact other aspects of overall hormone health as well. So things that I just feel really passionate about because I don't want it to be a taboo subject, and I want you to be so, so well supported and understood in what the job brings, appropriate tracking of that, and then how do we support you moving forward. So I hope that that came through in today. Um, One other just note, I didn't put a slide in on it, but was talking to one of the prescribing physicians, and he was saying that, obviously there's a lot of conversation around peptide therapy in this world as well. And one huge caveat I want to give is it's not a supplement, and it's often sold as a supplement. Peptides are not a supplement. They are also not FDA approved. They are for research purposes only. So procurement of such things is wildly Wild West-y. Hard to know what you're actually getting. And because so many of these peptide therapies are injectable, you should be very concerned about things that you are injecting into your body and very, very particular about it. A couple of other notes on it. Some of the peptide therapies that exist out there can impact growth hormone, which can impact growth of other cells within the body as well. Think like, are we assessing tumor or cancer risk as well in this overall picture? Um, but I wanted to comment on it because I know it's a highly talked about area. I am hopeful, I'll say that, about potential research in that realm, but we don't have it yet. And so when we talk about like safety data and stuff like that, it's hard to know what you're getting, who is prescribing, and how are they following along with that. So holding a lot of caution in that space, although Kelsey's brain is hopeful that I can always be proven wrong within the space of medicine and science. So all of that to say, thank you. Thank you for listening. I know this is a doozy of a recording, but I do all of this because you deserve it. I'm so incredibly grateful for the job that you have said yes to do, and you're worth it. You're worth it to be well taken care of, well tracked, and well supported in your career. So, thank you for listening. Thank you for the time, and I really appreciate all you do. Thanks.